Regulatory Affairs, and Community Health at the University of Maryland Medical System. And I'm happy to host this webinar today. Welcome all to Let's Talk About Health, the first of our new monthly community conversation series on key health topics. Our goal is to provide straightforward, clear information to members in our community. We believe in bringing awareness to important health issues, creating an environment to make patient communication with healthcare providers easier and more meaningful, and in giving people tools to maintain better health. Every month moving forward, we will conduct a community conversation on health topics like this today in this webinar format. We've selected the noon hour for these webinars today and moving forward in order that everyone may have an opportunity to join in the discussion at lunchtime. So even when people return back to work, they may be able to tune in and join us on a monthly basis. Today, we're talking about telehealth and technology. Telehealth is sometimes a term used interchangeably with telemedicine. It's the practice of caring for patients from a distance when the patient and the healthcare provider are not physically in the same location. It also allows patients and providers to exchange information, advice, reminders, education, intervention, and patient monitoring. As will be discussed, telehealth is available to patients and healthcare providers in a variety of healthcare arenas and areas and about various diseases. If there's one thing that's happened positively about COVID-19, it's that it has greatly and very successfully accelerated the use of telemedicine, telehealth across the University of Maryland Medical System, as it has across the country. We have two excellent telehealth leaders from the University of Maryland Medical System here today who will guide us through this conversation. Dr. Joel Klein is the Senior Vice President and Chief Information Officer at the University of Maryland Medical System. He's an emergency room physician and he continues to practice emergency medicine and teach medical school residents today. Dr. Klein began his work in information technology in 2004 at the University of Maryland Baltimore Washington Medical Center, where he also served as the Assistant Director of the Emergency Department and President of BWMC's Emergency Physicians. Dr. Ted Crocco is a professor in the Department of Emergency Medicine at the University of Maryland Medical School. He's the Vice President for Telehealth and Access Center for the University of Maryland Medical System and the Interim Chief Clinical Officer for the University of Maryland Medical Center. He comes to us from West Virginia University, where he served in numerous positions, including Chairman of the Department of Emergency Medicine and Chief Business Officer for the Health Services Center, in which he held responsibility for developing innovative methods of delivering more efficient, effective care. Ladies and gentlemen, as the webinar proceeds, please feel free, if you have a question, to type that in the Q&A box. Our presenters will be happy to address as many questions as we have time available today. We'll also be able to respond in writing to other questions that are not addressed live today, and they'll be posted on a website, which I will give you later as we proceed. Dr. Crocco, can you lead us off?
Thank you, Ms. Jacobs, and thank you to everybody who is joining us this afternoon. So I'd like to start off by just emphasizing some of the themes that the University of Maryland Medical System has identified as priorities as we move forward in the health services that we provide to our communities. High quality care, a commitment to our community, a transformation of the healthcare that we deliver, and coupling that with innovation and discovery are at the core of what we are doing at the medical system. For my purposes of today's presentation, I'd like to focus in on the third theme, the transformation of healthcare delivery, and specifically what telehealth and telemedicine can do in this space. Next slide, please. So Ms. Jacobs already alluded to what telehealth is. And on the screen in front of you, you can see the formal definition is provided by the American Telemedicine Association. But the short version is this: it is healthcare from a distance. And it is important, I think, to underscore that healthcare isn't necessarily limited to physician-provided healthcare. It comes in a lot of other sorts of flavors, from nursing and social work and pharmacy, physical therapy, occupational therapy. There are a number of different modalities and personnel that are now equipped to develop or deliver, I should say, the telehealth and telemedicine that we are building upon. Next slide. So this slide underscores the different types of telehealth delivery. It talks about very broadly how it can be deployed, what it can deliver, and what the basic platforms and the way the telehealth can be delivered. So for example, telehealth can be used to diagnose conditions, to accelerate treatment, earlier treatment. Telehealth is also being used between various physicians, between physicians and nurses. It provides professional consultation between a variety of different healthcare providers. It can also allow us to monitor patients and to coordinate care between the different specialists and primary care physicians. Beyond that, we can also deliver telehealth in real time, actual provider-to-patient visits. I suspect there are a number of people on today's webinar that have actually participated in this sort of telehealth exchange. We're now equipped to send people home with various devices that help us monitor their blood sugar or their blood pressure to make sure that the trends and the direction of the healthcare is one that's desirable and is not moving in a direction that requires intervention. There's also the whole application of some telehealth being used where a picture or an image is taken, it is sent to a cloud, and it's reviewed later by the physician. This is a frequent application in dermatology as an example. Getting an image of a rash that can be stored and later shared with a dermatologist to assist with making the diagnosis. And the way this connectivity occurs obviously started with telephone connectivity, but now the telehealth connectivity is even more robust, and it's got high fidelity audio and visual. You can see the provider, you can see the patient, it's real time, it's very helpful on both sides of the connection for provider and patient. Next slide. So the goal with all of our telehealth endeavors is to provide better access to care. So consider, if you will, the in-person visit, which requires scheduling for transportation, making sure that the visit fits into your busy schedule. There is, of course, the transport home. And so telehealth offers a convenience factor, the ability to connect with your provider, the nurse, the social worker, whomever it may be, in the comfort of your own home. As somebody recently said to me, what could be more convenient than connecting in your slippers? Better care delivery. So this heralds back to a comment I made a couple of minutes ago about remote patient monitoring, the ability to track a person's blood sugars or weights and blood pressures and so on. By knowing when any of those values or the trends are moving in an undesirable direction, it affords the healthcare provider, the healthcare community, to intervene and help correct the course. By doing that, we attempt to get better outcomes. We are working to keep people healthy, maintain good health, rather than intervening only when a set of circumstances requires emergent treatment. We're trying to be more proactive than reactive. And by doing this, we can lower costs. we can reduce the cost to the health system. We can also reduce the cost to the patients. And of course, the convenience factor that I alluded to earlier. And then healthcare workforce support. Recognize that there are a number of clinics that are staffed by nurses and physicians and pharmacists and so on. And of course, they're in different parts of our community. They're in different regions of our state. And by connecting through telehealth, we have the ability to be in multiple different places at once. Telehealth allows us to deliver certain types of clinics in western parts of our state in the morning and the eastern parts of our state in the afternoon. It makes us imminently available in a way that was not previously achievable. Next slide. So just a sampling of some of the telehealth services that are available through the University of Maryland Medical System. We have been providing behavioral health support for many years now, and cardiology is also very active. I alluded to an application as it relates to dermatology and the ability to get diagnoses through image collection, monitoring of blood sugars, and is an example of the endocrinology applications. In the emergency department, during the course of the COVID-19 response, we deployed an application called Teletriage. It helped connect from a centralized location within our medical system to multiple emergency departments that had emergency medicine providers available to evaluate patients through this telehealth connection. The ophthalmologists are also using telehealth, and family medicine uses it for many of their primary care visits. The obstetrics gynecology, the Department of Internal Medicine, also using telehealth. I alluded earlier about physical therapy and occupational therapy and how they can assess their patients and follow up, as can the lung doctors. And we're also connecting to skilled nursing facilities throughout our region, help provide support to those facilities that have questions, follow-up questions following discharges. We're able to assess patients to make sure that they're on the course since the time of their discharge, and to evaluate patients before they're necessarily even transferred to a hospital for further evaluation. Those are two common applications that telehealth is used for in the skilled nursing facility space. Sleep studies, the urology clinic, and women's health are three additional examples of applications. And I should mention that the University of Maryland Medical System is adding new applications for telehealth all the time. This list continues to grow in a very fast pace. Next slide. So just 6 things to know about telehealth. There's obviously more, but here's my top 6. Number 1, it's easy. It's very easy to connect. Getting set up becomes easier and easier. And momentarily, Dr. Klein, I believe, is going to give an example of just how easy connectivity can be. And then when you are set up, it's just a matter of a couple of clicks on your computer, or your smartphone, or your tablet, and voila, you are connected with the provider on the other side. Second, virtual care certainly helps combat the virus. COVID-19 cannot jump through the computer and infect somebody on the other side. I alluded to the Teletriage application when I was talking about the emergency department a moment ago, and we developed that particular application in order to reduce the healthcare provider exposure to people who may have had the coronavirus, as well as the convenience for the patients. It was a fast-moving process that allowed us to quickly evaluate patients and to determine the next best step in their medical management. Third, it's versatile and it's safer than you would think. We have taken extraordinary efforts to protect all of the content that's going through these connectivities, these audio-visual connectivities. I had a list on the slide a moment ago that showed you all the different applications where telehealth can be used. And as technology continues to grow and our ability to do things virtually from a distance continues to expand, the number of applications for telehealth in the future virtually seems limitless. And fourth, the insurance companies are making it easier and easier to get coverage for these virtual visits. If there was any notion before coronavirus came along that telehealth would take off because of the convenience and the efficiency that it offers, well, coronavirus has put that to rest. There's been a tremendous movement to telehealth for some of the reasons that I've already described, but there's been a great utility in using this during the pandemic. And the insurance companies and the regulators, for that matter, have taken notice. I can only assume that a lot of you on the webinar today have seen reports in the news about different areas of the country and how they're using it and the applications that are now possible. And so people are taking notice of the application, and it's becoming embraced more and more with each passing week. You do need internet access in order to tap into telehealth, so that's something to know up front. And I can only presume that the majority of people who are listening to me now do in fact have internet access. That may not have been the case 10, 15, 20 years ago, but as time passes, so too does fast internet access become tenable for all of us. And then lastly, inpatient care may never be the same. We have gone through a terrible pandemic, and to Ms. Jacobs' earlier point, this could be one of the silver linings to the pandemic that we are currently experiencing. It has changed the way we have approached medicine. It's changed the way that we've approached healthcare. It's changed the way that we look at taking care of chronic diseases and managing acute illness. And so my humble opinion is that things will never quite go back to the way they were before the pandemic, and that's a good thing. There's a tremendous opportunity that lay before us. So these are exciting times to be a part of healthcare in general and telehealth especially. Next slide.
All right. Thanks very much, Dr. Crocco, and good afternoon, everyone. Once again, I'm Joel Klein. I'm also an emergency room physician, just like Dr. Crocco. My responsibility, as Ms. Jacobs said, is for all of technology at our health system. And I wanted to put everything that Dr. Crocco has just been talking about in a little bit of a broader context and give you kind of the big picture of what we've been working on here at the University of Maryland to make doing business with us, to make taking care of your health a lot easier. And a lot of this has to do with empowering you to get your health care at home. And telehealth is a really big part of that. But there's a lot of other, actually even simpler things that we've made available for our community that I want to make sure everyone on today's webinar knows about. And these things come through the app that you can get right now that let you do business with us, with the doctors that you've seen at the University of Maryland Medical System. So the app is called MyChart in the patient in the app stores for both Apple and Android. You can get the app, install it. There's a few quick things you have to do to get it set up, and then you're off and are ready to go. You can also do this using an internet connection, and I'll talk more about that, just from your desktop computer in just a few minutes. So there's tons of things you can do here. You can make appointments if you've got a relationship with a doctor and you've already seen them and you just need to come back in for a follow-up visit. You can actually search the schedule for many of our providers and pick a visit out and make that appointment while you're doing something else, while you're in line at the grocery store. You don't need to look up our phone number and call and wait for someone to get to you. You can just make the appointment. You can see your test results. As soon as they're available to us, they're available to you. We have a few tests where our providers will want to reach out to you and talk to you about the results. So there's a small delay for that to happen. It's a very few tests. Almost all of them are available immediately. There's no need to wait to get something in the mail, or you never hear back from somebody. It's all there for you. This is your data and you have access to it immediately. You can send messages to your doctor. So if you just have a question about the visit you just had, or if you want to clarify something or let them know just an additional fact about what's been going on with you to make sure that that doesn't change the opinion they just gave you, just send them a quick note through the portal. And finally, you can pay your bill. There's no reason for you, again, to be, sending checks in or again, spending a bunch of time on the phone. It's very, very easy to take care of that using our app. And I should just add, my mom, who lives in Leisure World, she just moved up here from Texas, where she got all of her health care from a completely different set of providers. She told me when she moved here that she wouldn't consider a new doctor that didn't have all of these features and capabilities. So for even someone who's a little older, this is very easy to do and very accessible, and something that a lot of our patients really expect us to do. Next slide. One of the other exciting things that we're working on is to bring some of these other, again, technology features that aren't just telehealth from the outpatient setting, that is where you're out at home and interacting with us and doing business with us and getting your care from us, but to do the same kind of thing if you should happen to need to be hospitalized. So I know many of you perhaps have spent time yourself in the hospital, or perhaps have been with a family member or friend who's been in the hospital, and it can be a pretty frustrating experience. So we're right now piloting a bunch of technologies that I'll just briefly mention that, again, make it easier to relate to the staff, easier to know what's going on, easier to understand what's happening to you while you're in the hospital. So this is an application, it's actually the same app that we talked about in the previous slide, that lets you see who the people are taking care of you, who's my doctor, who's my nurse, what's happening to me today. So one of the complaints we sometimes hear is that, we heard we're going to get an x-ray or have a procedure done and we never know when it's going to happen. This app actually tells you when that's going to happen. Maybe not, at 4:05 p.m., but it gives you a rough idea of when we're targeting to get something done. It gives you information about why you've been admitted, what the problems are that your care team has identified, which can be hard to remember if you got admitted all in a blur, and it's tough to keep track of all of that. It's right there for you. There's requests that you can make about simple things like some ice chips or some help adjusting the lights in the room or to get a blanket. These are all things that you can request on the app while you're there in the hospital. We're working on ways of making entertainment possible. We, of course, have televisions in all of our patient rooms, but we'd like to be able to offer you something that's a little more apropos to the year that we're living in. We'd like to be able to offer you on-demand movies and other kinds of entertainment. So that's something that we're actively investigating right now. We're starting to make more of your complete chart available through the app. So all the notes, all the other details, not just lab results, but other things so that you can understand exactly the care that you've received from us. And then how can we do telemedicine, everything Dr. Krakow just talked about, how can we do that in the hospital? So in many cases, we'll have a patient who's hospitalized in one of our community sites, but has a really complicated problem that would benefit from talking to a super specialist that we might have, for instance, at our university medical center, our flagship hospital downtown. And sometimes in the old days, we would actually transfer patients just to make that connection and just to resolve whatever it was that, that would the medical question where we wanted to get that specialist's opinion. But now we can actually connect you via telemedicine while you're in the hospital, which could prevent you from needing to travel, in some cases, even hundreds of miles to get to downtown Baltimore. We can keep you in your community and get the question answered right there. And then finally, we've been developing technology that lets you make video calls from hospital supplied devices to your family. And this has been a huge issue in the COVID-19 pandemic. We've had lots of patients who get hospitalized and their family doesn't have any way of contacting them because maybe they didn't think to bring their phone with them, or they maybe have a phone but it hasn't been charged or something like that. So having devices where you can essentially video call your family, that's something that we've made available, and we've done tens of thousands of those calls between our patients and other folks around the community. The last slide. So again, just to try to sum up, what we're really trying to do with all of this is to be responsive to the needs of our community. And again, getting back to the theme that Dr. Krakow started with, to try to be as innovative as possible and really be there for what the community expects of us. So convenience, responsiveness, being transparent about the care that we've given you and making it accessible to you, and then just being efficient and respecting your time. That's really what we're trying to accomplish here. Next slide. So I've given you a couple of screenshots here just to give you some first steps or next steps on how you can start using some of these features that we've made available. So again, the app that you want to get if you have a phone is called MyChart. You can search for it on either the Android or Apple Store. This is what the icon looks like, and this is what the application looks like. It's very, very easy to use. You can also go to our website, and there are links on the home page of our website to get to our patient portal. I've shown the address here in this slide. You can use that as well. And it actually offers all of the same features on the web version as is on the app. And so that's what we had for you this afternoon. Dr. Krakow and I are happy to take questions that any of you might have.
All right. Thank you, gentlemen, both. There are several questions in the queue. And the first one is, how popular is telehealth? Is this something that the University of Maryland is doing? Are other hospitals doing this as well? And is it effective?
Well, Dr. Klein, I'll take first swing at this. It's become very popular. As I mentioned earlier, it only takes a quick glance at the newspaper or watching your local nightly news to see a segment or a piece about the various applications of telehealth. And in fact, I'm regularly seeing commercials on TV about the convenience of telehealth being afforded by various medical systems, including our own, the University of Maryland Medical System. So it has really grown in popularity because of the convenience, because of the pandemic itself, concerns around viral exposure. Is it effective? Yes, it is. It has a lot of different applications. And I should really underscore that telehealth is envisioned to be complementary to the in-person visits. As an emergency medicine physician, just like Dr. Klein, I fully expect that patients will still be coming to the hospitals for procedures and certain evaluations. There's no doubt about that part in my mind, but it is intended to be complementary to help with the overall care of patients.
Okay, there's a question here. Does telehealth actually work for psychiatric visits? How is that possible?
So the behavioral health applications with telehealth at the University of Maryland Medical System have been going on for a long time. It actually is a very robust system where our behavioral health specialists have over 50 points of contact throughout the state of Maryland. Patient evaluations are done through the high fidelity audio and visual connectivity based upon all the discussions I've had both with the behavioral health providers as well as the patients. It's being very well received. It is, or it was, one of the earliest applications in the telehealth space and continues to be a very popular application of telehealth across the country.
Yeah, I'll just
There
add a
are okay, go
couple
ahead, Joel.
follow-on comments there. So Dr. Krockow is absolutely right. And this is actually one of the areas where we've been able to bring a specialty that has a pretty big shortage of providers to places where telehealth where psychiatry is a huge issue. So in the correctional system, it's been used very successfully. It's been used in pediatric populations where child and adolescent psychiatry is something that we just don't have enough of those providers. And I would agree, it works very, very well.
There are a couple of related questions here, so I'll try to group them together. The first one says, how can telehealth actually determine preventive healthcare issues? For example, my husband had cancer and would not have known, no symptoms were obvious, if he had not been directly seen by his primary care doctor, which prevented further damage or death. And then there's a second question that says, will cancer patients be included in the future?
So again, telehealth is intended to be complementary to in-person visits. And there are a number of different applications right now where the telehealth is used in a screening capacity, in a counseling capacity. So you should really view telehealth as complementary to some of the conventional delivery of healthcare. With regard to cancer patients being included, yes, of course. We are actively working on a particular application for telehealth right now for cancer survivor support groups. Again, cancer is one of those applications where screening, series of questions can help the primary care provider or the specialist know what is the level of urgency of getting a patient into the office to do further imaging, further testing, et cetera. And so telehealth can in fact be helpful in that arena as well.
Dr. Krockow, I think the message that you're delivering about the complementary nature of telehealth is so very important. But just as I look at some of these questions, it's not a substitute for, it's not the only way that healthcare is being delivered. It's an additive to the way that healthcare is being delivered, and it's providing an opportunity for convenience so that someone doesn't have to come to the hospital or to see their doctor in person repeatedly when some of those visits can be off-site. Is that right?
Yeah, that's exactly right. It gives
and
us
then,
a whole, yep, go ahead, I'm sorry.
Go ahead, finish. It gives us a whole...
It gives us a whole new level of convenience for the patient. It expands the scope of what we're able to do, and it really helps us to keep patients on a healthy course. Because remember, telehealth also allows us to keep people healthy. So imagine, if you will, the telehealth applications after a patient's cancer diagnosis or any other diagnosis wherein they're sent home. Telehealth has a real strength in being able to assist the providers, again, not just physicians, but the nurses, the nursing practitioners, and so on, to make sure that the patient stays on the path toward good health.
Okay, important. The next two questions both have to do with sort of finances and money. One is, will telehealth increase my copay? Let me go ahead and tell you what the other one is. And the other one says, I'll just paraphrase a little bit, it seems that the use of telehealth is more about money rather than human beings. Other entities are seeing patients in person.
So at the University of Maryland Medical System, we are still very supportive of seeing patients in person. With regard to the part about co-pays and so on, so that's a difficult question for me to answer because there's so many different types of insurance out there with different rules. that you'd have to check, quite honestly, with your specific insurance carrier. I will say this, though, very broadly speaking, telehealth is intended to reduce costs within the healthcare system. It's intended to make us more efficient and to reduce the costs for the patients themselves.
Let me just say, for people who may have joined us a little bit late or who didn't hear the first part of this session, if you have a question, go ahead and type it in the Q&A box and we'll try to address it there. Because we have quite a number of people on the line, all of the participants' lines have been muted, but you can write us a question. We'll try to get to them as soon as we can. Next question: how do I, as a patient, know when to come in for a visit versus using telehealth? What do I do? It's a multi-part question. What do I do if I think an in-person visit is right and my provider is saying something else? I don't want to get to the point where I need an ED visit because we couldn't agree. How do I handle that?
Great question. And it's one of the considerations that the regulators are taking on right now. There is now the ability for patients to ask their providers. Let me use primary care as an example, where if a patient does have a concern, you can actually use telehealth to send an inquiry to your provider. It's using many of the platforms that Dr. Klein described, being able to send a message to your provider expressing your concerns, and from there it really becomes a discussion between yourself and your healthcare provider as to the next most appropriate step. But that is supported through telehealth today.
Okay, we are now, the questions are flooding in. So a couple of that are, again, that are related to one another. What are the security measures using the app and access to all patient information? Do patients sign consent for their medical care through technology? And another question about security of medical records.
So I can try that. So we use primarily a platform called Zoom, which is something that a lot of people are using around the country. We have a very different relationship, though, with Zoom that you might have, for instance, if you're just reaching out and chatting with a friend or a relative during the pandemic when everyone's in quarantine. We use the commercial version of Zoom, which is very heavily encrypted. And we are also using passwords and other things that make it very, very unlikely that these are safe meetings to have. As far as the other technology that I talked about, that is all extremely safe. It's data that we control here at the University of Maryland on our own equipment, which is audited 9 ways to Sunday. We're very confident in the security and safety of your data in our hands.
Okay, I'm going to try to flip through these very quickly. So if you can give us succinct answers, we might be able to get to about 3 or 4 more. Is there a list of the types of visits that are not appropriate for telehealth? For example, prostate exam, but the comment also goes on to say, but when you touch a person physically, you also touch them emotionally. So that physical meeting might be really important.
So there's no list per se, but the question's a good one. There are still those parts of healthcare that require physical presence. And so you can imagine some other examples that require human-to-human contact to do assessment. And so we're not there yet in our telehealth development, but there's no specific list like the question originally asked.
Okay, I'm going to give this one, and I'm going to give the following in 3 parts because there are 3 related questions, all about logistics, if you will. One says, is there a central contact at UMS for telehealth, or does each office develop telehealth. Let me keep going. So central office, or how do you reach out? One says, I have an appointment in August, but I haven't heard anything. What happens next? Do I contact my doctor? And then the last one is, if you don't have internet at home, has there been any thought of partnering with public entities like libraries or something else so that people can do telehealth from another location?
So to answer the first part of the question, you can learn more about telehealth for the University of Maryland Medical System on a web page, and that's easily found through a search engine. But it is probably also important to connect with the specific physician office or department that you're looking to follow up with. The second question, I apologize. What's the second question again?
I have to go back to it myself. The third question is about partnering with others. The second question says, I have an appointment in August, but I haven't heard anything and I don't know what I'm supposed to do.
Right. So thank you. Thanks for the reminder. I apologize for that.
Okay.
So the best recommendation that I could give there is to reach out to the office where the physician or nurse practitioner, physician assistant, et cetera, is scheduled to get follow-up as to the status of that appointment. And then I do remember the third part of the question, which was related to those people who don't have internet access at home, and is there the ability to get this performed in a community space where you can connect? And the answer is yes, that does happen. It obviously is going to be community specific. I can't attest to the availability of those resources in every specific community throughout our state and region. But if the question was, can it be done and is it being done? The answer is yes.
Okay, we have about a minute and a half left. I'm going to just answer one of the questions for you all, which is, does UMS accept patients who are on Medicaid? The answer is absolutely yes. And then the last question I think we'll end with today is UMS partnering with any other hospitals across the state that are not within your system to do telemedicine?
So the short answer is yes. We have several ideas, telehealth applications that are under construction right now. The community should be seeing more of that in the coming months and years. But yes, we are absolutely looking to partner up with other medical systems within our state and region.
Great. All right. I want to thank you both for the information that you've provided. And I want to make all of our viewers aware, you may have heard me say at the top, that this is the first in a series on Let's Talk About Health, where we'll be bringing conversations about various health topics to the community once a month at noon so people can really participate. It's also important for you to know we've set up a link where you can go in about 48 hours and hear this entire presentation. You can see all of the slides and hear the commentary as we went along. And that is www.ums.org/let's talk. So it's a very simple website. You can get information, and we will post each and every webinar as they occur a day or two after they have been broadcast. As well, we will take all of the questions that came in today. I won't promise them in 48 hours, but we'll try to post answers to those questions on the site as well. So if your question was not answered today, look for it soon, and we'll try to get that up for you. In July, on July 15th, we will be talking about better patient-provider communication and accessing care. So you see that's listed there. If you received an email about this presentation today, you will get one about that in the future, but you can always go to our website and see what is upcoming month to month. Again, thank you, Dr. Crocco. Thank you, Dr. Klein, for your participation. We really appreciate it, and we wish everyone a great day. Thank you so much.